Hello, everyone. Today we are going to discuss malingering in the context of a forensic assessment. At the end of this lecture, I hope that you will understand the importance of thinking about the potential that a defendant can be malingering, but I also want to make sure that you're not overly concerned with malingering in the context of criminal procedure. There's always a possibility when you have a defendant who is facing some kind of severe outcome following a criminal conviction that they may raise some type of mental health issue. For that benefit, that will come from a finding, for instance, that they may have a history of problems that might warrant some mitigation in sentencing, or that they may not be criminally responsible, or have some kind of mens rea defense. There's a potentially positive outcome for that person. Whenever there is a secondary gain, you have to be concerned about the potential of an individual potentially malingering or faking a mental illness. This issue is more common in litigation where there's money on the line. So, something, for example, like personal injury claims or insurance claims, things of that nature. You see much higher rates in the literature. That's not to say that this doesn't happen in the criminal context. Of course it does, and of course it can. So, we always have to be aware. You'll likely be dealing with run-of-the-mill cases that are coming through the system, not high-profile cases or cases where there's some type of a very egregious crime, and there's really no pathway for the defendant apart from some type of mental illness claim. When you're dealing with this kind of run-of-the-mill criminal cases, you're getting calls from public defenders, and the reality is that public defenders do not have the money to throw around looking for malingering. Malingering is not going to be everywhere you look when you're doing forensic assessment in the criminal justice system. That said, it's just important that you're aware of it. And of course, you need to be aware of the flip side as well. People who are faking good or trying to underplay their problems, because there are certainly going to be contexts where you're going to be assessing a person to determine that they don't have mental health issues or drug addiction issues or some other problems that may, for instance, preclude them from getting custody of their child, for example, or getting out on bail or being released from some type of confinement. Overall, you have to be aware of both sides of impression management when you're doing forensic work. But for our purposes today, we're going to keep it short and sweet. I just have 2 slides that we're going to go over, and I just want to introduce you to the idea of malingering, the concept, and how we understand what it is and how we might assess for it in the context of forensic assessment. So, what is malingering? The definition of malingering is voluntary falsification or fabrication of symptoms for secondary gain. So keep this in mind. This is the voluntary falsification or creation of symptoms for secondary gain. Those are the 2 key pieces. You may also have exaggeration of existing problems for secondary gain, but the idea here is that it's really voluntary. The individual is aware that they are falsifying and they are trying. They're doing that for some secondary gain, and in the context of criminal adjudication, usually the defendant would like some kind of more lenient, less severe outcome, perhaps diversion or not guilty by reason of insanity, sentencing, mitigation, so on. Now, it's important that we distinguish malingering from a couple of things. We want to distinguish malingering from factitious disorders. A factitious disorder is when an individual doesn't really have a particular illness or set of problems, but the problems they have are actually a motivation to assume the sick role. So a person has a motivation, maybe even outside of their own awareness or some type of unconscious motivation, to be in the role of a sick individual. That's not the same thing as malingering. Another thing that you want to distinguish malingering from is this naive understanding of a person's own situation. So what do I mean by this? Let's take an example of a civil case where an attorney, in many ways, is convincing his client that some of the issues that she was having, so say, for example, some memory problems, were related to a relatively minor fall that she had. And she believed that these issues were related to that. but really these issues look like they had been long-standing. So again, you want to distinguish from naive understanding of why a person is having a symptom from malingering. It's maybe just a naive understanding of their own history. And then it's important to distinguish malingering from cries for help or calls for justice. This one's a little bit trickier because I just finished saying that malingering is voluntary falsification or fabrication of symptoms, and you might have a situation where a person truly does have issues, but they're worried that they're not going to get the help that they deserve or that they're going to get the justice that they really deserve. So maybe they're exaggerating or overemphasizing the importance of these symptoms. Again, I would be very careful in mistaking that for malingering. I would be careful not to assign the diagnosis of malingering to that person because they may really be suffering and they're just afraid that they're not going to be believed or that their symptoms aren't going to be recognized or understood by you, the mental health examiner. Malingering is an intentional falsification or fabrication for secondary gain, but you want to distinguish it from these other things that could potentially look like malingering. Okay, so by now you know the definition of malingering is an intentional falsification or fabrication for secondary gain, but you want to distinguish it from these other things that could potentially look like malingering that we just talked about. You also want to keep base rates in mind. When you're thinking about risk of recidivism, recidivism is relatively low, right? So you need to be thinking about general base rates before you start throwing around diagnoses. Estimates of malingering can be quite high in some contexts, and in fact, personal injury and medical insurance cases, estimates of malingering can be quite high in some contexts. Remember, we talked about personal injury and medical insurance cases. Some estimates of these types of cases put malingering as high as 40 to 50% of those types of cases. Generally, cases of malingering in the criminal justice system are much lower than you would see in the context of personal injury. Keep in mind the overall context. You should know something about the case. You should know something about the implications of the various outcomes of your assessment. You should know something about the level of attention your case is getting and what the attorney is thinking about the case. And all of this should help you inform your opinion about the likelihood that this person could be malingering. At the end of the day, though, I think it's really important to keep malingering as a last resort diagnosis because it could be quite damning. There are many ways you could talk about how a person is presenting without reaching the diagnosis of malingering or falsification for the purpose of secondary gain, which could really derail someone's outcomes. For example, if you see malingering in a case file, that could really influence how the next practitioner sees this person, how they view them, how they interact with them. So that doesn't mean you should avoid ever reaching that conclusion, but you do want to make sure that you're aware of all these factors. So we're going to move on to our next and last slide. We are not very good at detecting malingering on our own as clinicians. Obviously, if someone is malingering in a kind of unsophisticated manner, it will probably be obvious to most well-trained clinicians, but we might miss subtle malingering, or we could even misinterpret some extreme things that a person might say if we're not used to seeing people in a particular context. We need to use some type of objective measure of malingering as part of our evaluation. Whether you use the same battery for every assessment or you create a tailored battery for every person, at the end of the day, you should be doing something beyond just your own personal judgment to make sure that you have a sense of that person's responses and whether they are valid or reliable. So we want to use a tool that will provide a consistent and valid assessment of their abilities or their mental health status. The MMPI is one of the best normative tools for picking up on malingering, but it is very, very long. The MMPI is useful in the context of malingering psychiatric disorders. So remember that, psychiatric disorders. So you might have a person who's malingering cognitive disabilities or attention problems, executive issues, language problems, and so forth. You're not necessarily going to pick up those types of things with the MMPI. So if your referral is covering cognitive issues, maybe the attorney is concerned that there's some type of head injury or maybe a developmental disability, for example, and your concern is cognitive functioning, then you want to be using a tool that's going to help you pick up on some types of those symptoms. In that domain, there are basically 3 general types, or the most common or the most popular, and these are going to be forced choice paradigms. So for a forced choice paradigm, this means that you're asking an individual to make a choice. Maybe that's yes or no, this or that. They have to respond by choosing one of 2 outcomes. The reason why these tools can be useful in picking up malingering is that if a person really doesn't know the answer to the questions, then they won't know the answer to get them right or to get them wrong all the time. And so if a person is actually not able to respond correctly because they don't know the answer, then they should be randomly getting these questions right or wrong. Because if you know the answer and you're intentionally getting them wrong, you're going to have a statistically unlikely number of wrong answers. On the other hand, if a person does know the answer and they're responding honestly and truthfully, they're going to have a high level of correct answers. So let's use some more concrete examples, and I'm going to talk about the TOMM. The TOMM stands for the Test of Memory Malingering. This is one of my favorites. And when you're using the TOMM, the forensic psychologist shows a bunch of drawings to the defendant. And then after they look at all of these very basic drawings, they're kind of like stick figures, you show them options where they see one of the drawings that they've already seen before, as well as a new drawing that they've never seen. This is a memory test. You ask them, which one have you already seen? Usually the person who has memory problems, even in most cases, unless very, very severe memory problems, should do well on this test because it's a recognition memory test. So people should be scoring very, very highly, even nearly perfect. But if a person does remember and is intentionally trying to look like they don't remember, if they're not sophisticated, they're going to just keep picking the wrong answer or picking the wrong answer much more frequently. And so that's an example of one of these forced choice paradigms that can be useful to help out, kind of weed out malingering from non-malingering folks. With that being said, these are relatively easy to be coached on. You could learn how these things work and answer honestly, and then try to malinger on other aspects of the evaluation where it's more difficult to pick up on a more sophisticated approach to malingering. So these forced choice paradigms are pretty good at picking up gross malingering, but they're not necessarily going to pick up if you have someone who's very sophisticated at fabricating cognitive symptoms. But don't worry, there's other things you can do. Embedded measures are quite useful. Essentially, what you do with embedded measures is that you're looking at how people are responding to typical test items, typical cognitive measures that aren't actually designed for the purpose of malingering, but you can use them to think about whether a person is malingering by thinking about the ways in which people are responding and if it is very unusual or abnormal compared to how people typically respond. For example, think about the WAIS, the Wechsler Adult Intelligence Scale, and think about digits forward and digits backward. So you're going to give someone a string of digits to remember, and you give them that list of digits. For digits forward, they're going to tell you those digits in order, kind of mimicking exactly what it is that you said. But for digits backwards, it's a bit harder. You want them to tell you the digits in order that you gave them, but in the reverse order. That's a harder task. Typically, people are going to do better on digits forward than they do on digits backwards. It doesn't mean that every person will, but generally people tend to do better on digits forward than on digits backwards. So, one of the many indicators that you might look for across an intelligence test would be a person doing better on maybe digits backwards versus digits forwards, because that would be unusual, not necessarily a red flag or an indicator of malingering, but it would be a clue, if you will. And that's an example of an embedded measure. There's also other tools. One that I'm going to talk about here is the validity indicator profile. This is also a forced choice paradigm, but they make it harder for individuals to do well on it if they're trying to be more sophisticated at malingering. So, very briefly, I'm going to give you an example. Someone using the TOMM, all of those items are equally difficult. So, I show you all of the pictures and I say, which ones did you see, A or B? Flip the page, which one did you see, A or B? It is all equally difficult. And then something like the validity indicator profile, you're giving people forced choice problems, but the difficulty of the items is randomized throughout the test. So if a person is trying to do poorly on the test, they're likely to do poorly on the items that they know to answer, but randomly on the very difficult items that they don't know the answer to. It's a little bit more sophisticated, but because of it, you're changing the difficulty and you may be able to see some patterns, whereas a person who's answering honestly will probably do better on the items that they know and may or may not get the answer correct for the ones that they don't know. A person malingering would have the opposite pattern. They would do poorly on items that they do know and then randomly on items that they don't know. So it's kind of a nifty little way to capitalize on that forced choice paradigm. On the psychiatric side, we've already talked about the MMPI and we touched upon it briefly already in this lecture. Essentially, the MMPI was designed through a process of giving a ton of items to people with different types of disorders and seeing which of these items differentiated these groups. So it's an empirically derived type of tool, but it's a diagnostic tool. But we can also use this tool to look at odd patterns, and that's how we can make statistical conclusions about potential malingering. Also, I want to talk about the SIRS. The SIRS is a structured interview of reported symptoms, and this is designed more theoretically. So the questions are designed with a sense that the person who is malingering mental illness might do, how they might respond, what might be difficult for them to do. And the difference between the MMPI and the SIRS is that the SIRS is actually designed with this theoretical understanding of how people might respond. For example, the SIRS will ask about very unusual and extreme symptoms, but the SIRS also asks, do you have problems with this particular issue? And if the person says yes or no, then the SIRS has you follow up on that question asking, how bad is it for you? Having them give a rating to you. You go through all of these various different items, but then what you do is that you go back through and you ask a number of those questions over again. And you look at the consistency of the responses, because the theoretical premises there is that the person is going to be able to remember if they really are ill. And if they are ill, they're going to remember having those experiences. They're going to be able to remember, for the most part, how they're doing, what that looks like. And yes, there may be some slight difference in how much of a problem something is for them over the course of the test, because this is self-report, but you're going to see consistency if a person really is experiencing that because they're answering honestly. But if a person is lying or making things up or trying to look sick, then you're probably going to see that they forget over the course of this very long test the answers that they've already given you earlier. And if you could look over the whole host of other things like that, the SIRS is designed for the purpose of basically tripping up a person who is trying to malinger. So those are a few types of tools that we have at our disposal. The SIRS probably comes closest to what we consider the gold standard in the field for diagnosing malingering, which is also a very long test and kind of laborious to use, so just keep that in mind. Also, remember reliability. You've learned about reliability and validity, so keeping in mind reliability issues. In your report, you could reference suspected malingering, or you could also use the words low effort. You could say something along the lines of, maybe this is not a valid assessment of someone's abilities, as opposed to necessarily reaching the diagnosis of malingering. There may be some professionals in the field that say that you should use multiple indicators of malingering in an assessment to reach a diagnosis. I think that you find that this argument, you should be using the most valid tool as opposed to multiple different various tools. For example, if you have 3 indicators and the most valid of the 3 indicators points away from malingering and the other 2 point towards malingering, do you use the best out of the 2 out of 3? I think there's a really good argument for saying that the most valid indicator would be the one that you should rely on. So that is it for the malingering lecture. Thank you for your time. I hope that you learned something today.